Welcome to Thursday Thought Leaders by BW Healthcare World. My guest today is Ms. Chandra Ganjoo, who's the Executive Director and CEO at Trivitron Healthcare. She's been at the helm of affairs at Trivitron from the time the company moved from a distribution-led model to a manufacturing setup for health tech in India. She is known in the company for her people skills and compliance to processes and the commitment to the growth of Trivitron Healthcare. Prior to Trivitron, she had worked with Group 4 Securitas, but has been at Trivitron for the last 23 years, having become now the Executive Director and CEO. Welcome, Ms. Chandra Ganjoo, to BW Healthcare World. Thank you for taking our time to be with us on the Thursday Thought Leaders.
Thanks a lot, Harbinder, for having me here. It's a pleasure to be in touch with you and know a little bit about you, and I'm sure you will have some questions for me. So thanks for having me here.
Absolutely. So let me begin with a very basic question. All of us as business leaders, we work around the principles of management and try and put them and align them to the business that we are doing. So we know that there is a 4Ps principle of place, people, promotions, etc. How did these strategies help you in building a successful Indian multinational?
Great. It's a great question. And when you're talking about 4Ps, I think I started my career in this company almost 23 years back. And it was 4Ps at that point of time. And 4Ps were people, product, processes, and performance. And from the last, I think, 20 years, 2 decades now, we keep on adding every P every now and then because, life has changed, world has changed, organizations have changed. So it's very, very important, I think, to start evolving yourself along the time. So I think along with all the fours, what you just now mentioned, I think we are keeping on adding new things in the company, new strategies, because what has worked 10 years back definitely doesn't work now. And especially post-COVID, things are completely changed for the Indian medical device industry. And saying so, still, I think the most important critical aspect of every organization is people, So every strategy in this organization definitely is people-based. And it is so important for any of the organizations to have a well-groomed, well-motivated, energetic team to work with, because no matter what strategies you make, if people are not aligned with you, you're a failure for sure. You don't need any surveys or any McKinseys to come and tell you about that, So I think we have been really focusing on aligning our people to our thoughts, and especially for us, shifting completely from trading to manufacturing has been a journey. And especially in Indian infrastructure, it was very, very difficult a few years back. So it has been tough to get very skilled people and make them stay back and telling them, hey, there is a future, just wait and watch, this is what we want to do. But we have been fortunate for that matter that the leadership team of Trivitron, I think 80% is with us since at least minimum 1 decade, because they believe in the story of Trivitron. They value the vision and mission what we have. So I think all the strategies, whether it is related to the region expansion, product expansion, or anything else, we take people in confidence and we drive all the strategies through people. So yes, the strategies are too many, and like I said, every now and then, depending on how the markets are performing, how the competition is doing, how the stocks are going up and down, I think you keep on changing your strategies. That is how we have been surviving till now, and I'm sure we'll keep on doing that.
I completely understand when you say that, the strategies keep changing and the Ps are getting added almost every 2 years. But you've been in the healthcare industry for over 2 decades. Is that correct? Yeah. So
exactly.
How have you seen the healthcare industry in India evolve in the last 2 decades?
Oh, there's a huge change. And I think the major changes happened in the last, 5 years, if you ask me, if I put in the numbers correctly. But especially, medical industry right now, what we say about 10 billion USD going at a CAGR of 37% and 25, we are planning to do 50 billion. So, I mean, it's not an easy job, especially looking at the background of our country where we started very, very small. Still, if you want to compare ourselves with the global players and the global and all the developed countries, I think we have a far way to go. But I think on the personal front, I'm very happy with the things that are moving the last 5 years, especially post-COVID. A lot of initiatives from the government is really supporting us, whether it is all the very specific PLI schemes they have launched or all these new medical technology parks coming in a lot of states in the country, or special promotion for the high-end manufacturing in India. I think it's really helping, especially the Indian companies where the support system was very weak and everything what we had to do in the past was supposed to be done by us independently. Now with the government joining us with their lot of initiatives, lot of programs, I think it's going at a very faster pace and things are shaping up, fingers crossed, very well for the industry as of now. Yeah.
So Chandra, when we began this conversation, you focused on, when we were talking about the 4 Ps, your focus was very emphatic on the people part of it, and
Exactly.
what I heard you say was that people actually create the fundamental success of any organization, and I totally agree with you.
Exactly.
How do you think that the human capital management in healthcare has changed with the changing times? The people, we have younger lot people who are coming in, they have a very different ideology and work style. The work in healthcare itself has gone through a sea change. There is more focus on innovation, R&D, etc. How are you managing your people management at Trivitron?
See, frankly, if you ask me, and I was talking to some of the industry colleagues a few days back, I think all of us are struggling. That's a fact. That remains a fact. Because if you see, if you want to be a computer engineer, you want to take computers as your future career options. There are specific computer courses in the colleges when they go and they study that. If you want to be a CA, there is a very specific course. But if you're talking or thinking of being in medical device company, there are no courses like that. If you ask me, it's randomly we pick the biomedical engineers once they leave the colleges, even if they are from the best of IITs, and then you try to groom them and give them the information and knowledge what we want them to learn. There is no sort of a thing where they are already trained in the colleges, and that is what I think in the budget also. If you have observed, there was very specific mention about having very specific colleges who can be very specific to the medical industry. So I think that is what we are all looking forward to, because right now there's a struggle. We try hard all the games what we can think of, but there's a struggle. One, the understanding of students when they come out from colleges is not really anything huge they know about the medical industry of, especially the devices. Pharma, at least you have a lot of pharma courses, but for medical devices, as of now, we never thought about it, So I think this is the right time, and some shaking from the government in the budget. I am very hopeful that a lot of things will shape up in the next couple of years. But right now there's a struggle, and we are trying our best, but there is definitely a huge vacuum over there.
And also, since we are talking of medical devices, supplies, etc., India was always known for frugal innovation. That jugaad karke kuch provide kar diya. And pandemic also, one of the ways that we succeeded as a nation was because of this becoming our strength. But post-pandemic, the focus on innovation has to be in a very different aspect, because here we're dealing with the healthcare industry where everything impacts on human body and survival.
Exactly.
Do you think that the innovation in its true meaning is changing in India when you're looking at manufacturing of medical devices?
Oh, definitely, yes, it is. I think I saw a big article just 2 days back where I am one of the big multinationals, Indian multinationals, who is not from healthcare industry. They started and they were talking about genomics, and they were talking about getting new drugs in the market. So I think that is how every company, whether it's a diagnostic company, it's a healthcare devices company, everybody is thinking on those terms, because that is the need of the present. And looking at how we are far away from the developed countries, I think a lot of focus are being done by the companies and the government itself. If I talk about our company, Trivitron per se, traditionally, when we started 20 years back, everybody was more focused on the basic, conventional business, conventional reagents and equipments. But now I think for everybody, for for the future of the generation and for the future of the country. We are all very, very particular about the futuristic medicine or futuristic device, what we call, what we usually say about. And I'm very happy. I think this is the first time I'm sharing it with anybody that in next 1 or 2 months, we are launching India's first CT manufacturer in India. So that is already in the last 2 years, we have been developing that and we are going to launch it so soon. So this is something what has really, really pushed from the after COVID, that we don't have to be dependent on other countries for our survival. Our dependency, our own home brewed, our own manufactured products is very, very critical. And I think that is what is happening. Even from the diagnostic point of view, where we were majorly into routine diagnostic kits and consumables, we are completely shifting to new next-gen technologies, where we are talking about genomics, we are talking about proteomics, So there are so many new things what every company, I'm sure, are talking about right now, because that is the only way we can survive, and that is the need of the country. You cannot be dependent on any other nation for your own basic requirements. So I think, yes, it has definitely changed.
So, Chandra, since you mentioned about diagnostics and the change in diagnostics that we are seeing, precision diagnostics is now an integral part of the healthcare system. What is one aspect that makes Trivitron different from anyone else in this domain?
Frankly, first of all, Harbinder, I don't think, if you 10 years back or few years back, there was always that I want to kill my competition. I mean, that is usually how every organization think about. I think today we are talking about collaborating with the competition, because I don't think any of us can survive the long term all alone, especially if you talk about the medical industry in India. We are not that big in shape and size where we can say, oh, forget about everything else, I will do it. So it's very, very important that we collaborate. If you have something with you where you are the master of that, and if I have something, I think the collaborative efforts and collaborative kind of programming is very, very important for us to really do well as a country. That is what I presume, and that's how, as in Trivitron, we are trying to do a lot of initiatives with some of the companies who have the cutting edge technologies. I don't want to name it right now, but yes, a lot of associations, a lot of innovations are happening in collaboration with other companies or other global companies who already have those technologies. And for us also, the major focus is definitely is going to be now from the diagnostic point of view. We are talking about genomics. We are talking about cancer cells. We are talking about newborn screening. So these are some things which definitely newborn screening. Trivitron is the number 2 company in the world, and number 1 being a US company. So we are in somewhere there where we want to do some things very specific to the country. Some things very specific to do certain, medical ailments where new technologies are needed.
So, Chandra, I'm so glad that you brought this word up of collaboration, because I completely agree with you and resonate that we as a country, we are a large consumer base. Our needs are much higher, and today is a time when we can not only collaborate but coexist. The market is large enough to accept the appetite of everyone in the industry. Now,
actually, I think as Indian companies right now, you don't. If I talk about medical device company, where I come from, I don't see any Indian company who is of that size where they can go and say, "Hey, I'm going to kill this company." I mean, it doesn't make sense. It will be just waste of time, waste of resources and money for all of us, So, and you see, India has become a global hub for all of the big multinational chains now. Everybody wants to invest in India. Everybody is very, very keen and putting a lot of focus in India. So, I think they're also looking for domestic partners, and for us, it's always very important to keep an eye for cutting edge technologies and new inventions happening globally.
Yes, I agree with you. So, Chandra, at Trivitron, you guys are evangelizing neonatal screening in a big way. That's a big concept that you are advocating. How do you think this will help in reducing the pediatric health complications in India?
I think this is something I'm sure for you and for me as parents, this connects with us also, because it is not something where we are talking about technology. This is something where we are talking about babies. We are talking about our children. We are talking about the future of every country, every generation, And India has a very high, infant mortality rate, 32 deaths per 1,000 babies, So how do you cover it? And as of now, unfortunately, as a country, we don't have a national screening program. I mean, there are some things for state-wise. Some states are doing, some states are not doing. There is no compulsion. But if you see all the developed countries, they have these programs running since ages. And it's not something the basic parameters. Some of the countries do 20 parameters. We are in India not even doing one single parameter. I remember I had 2 boys, and it never came to our mind that, okay, can we do it for them? That's the future. To safeguard their future. But I think as a country, as a society, as parents, it's very, very critical for us to think about it and make sure that this program is definitely implemented in our country. We are not talking about doing 100 parameters for a child. There are at least telling them that let's do the basic parameters. Let's know, I think certain things are happening on its own, like sickle cell, elimination, what lately the government has announced. So certain things, I am very hopeful it will happen, but how fast we are going ahead with those implementations is the question, And I think it's very important if government and private players partner together, things will move very, very fast. So especially for newborn screening is something. Definitely, yes, from the organizational point of view, but from the personal point of view also, I think this is something I definitely want to push it very hard. Wherever I had a chance, I would like to talk about it, because I think this is the future. This is what we are talking about for future generations to safeguard them.
Right. So, Chandra, I mean, we are listening to 2 things from the government and from the industry. One is heal in India. We need to move from heal in India to heal by India. We are also talking of made in India. And, when you're talking of the medical devices, medical tech industry, do you think we are well poised to create India as a manufacturing hub of medical?
100%, 100%. It's a matter of time, I think. I think the confidence in the companies ourselves, I mean, we just wanted to push, for India, for us Indians, we always need that push. I think that COVID gave us that push. I think if you see every medical device company in India right now, they are into something. There are a lot of innovations happening in the background. They may not be announcing it yet, but I'm sure it's going to take the country by surprise, the way that things are moving in all of the medical devices, where it's not only about the survival of today, we are definitely focusing on the future. So I think Make in India definitely is only a game changer for everybody in India, outside India. And globally, everybody is eyeing us. That, how we have been accepted as one of the great contributors during COVID also. And Make in India is going to be a definitely game changer for all of us as a nation, as a industry, and definitely going to help the economy to really, really go very high.
Chandra, I mean, when we're talking about the industry, when we're talking about medical devices, etc., I'm sure there's a great opportunity, but there are also challenges. Can you share what are some of the challenges that you feel need to be addressed, and what do you think that the policymakers in India need to do to change this and turn that into a great opportunity?
I think it's very simple. One, the good thing is that the policymakers have understood that to give a very big boost to this medical Indian devices, there are a lot of changes which has to happen from the government, because major change policy is their job. Implementation is their job. Some policies are implemented, but the speed, the way the policies are implemented needs to be relooked into. Is that the way? If certain things have to happen in 6 months, it can't take you 2 years. I think that is a little bit slowing down as an industry. Good part is, yes, they know they have problems. There are challenges, whether we are talking about the export duty or we are talking about the PLI schemes. Whatever the initiatives have been taken, somebody need to have a little deeper insight about, hey, how is the implementation going? And good thing is that there are a lot of interface now between the Indian medical device associations and the government. A lot of organizations are getting into those, and a lot of discussions are happening. But I still believe that the process needs to be a little faster. I feel that we talk a lot and the action is a little slow. The action need to be really, really super fast, because if you miss the bus, you miss the bus. There is no justification for that. So I think the policymakers need to really move fast with the implementation part of all the programs. Otherwise, if you see in the last 2 years, a lot of announcements have happened, whether you're talking about digital healthcare, you're talking about telemedicine, you're talking about Ayushman Bharat. So certain things are really moved at a faster pace. But coming back to the core of all the implementations, I think it needs to be a little faster.
Right. So, Chandra, how has it been for you as a woman business leader in the healthcare domain? And what is it that you think is changing that will help more women take on the leadership roles when it comes to the healthcare industry?
That's something very critical question, because I think my answer will be definitely different from when you ask it to another woman leader, because everybody has their own journeys. I still consider, and I keep on telling my team, I'm the fortunate one, because although there have been challenges, without challenges, you can't reach out to anywhere. But I had less challenges. But I know there are women out there who have challenges on day-on-day basis. However, keeping that aside, I think there has been a lot of improvement overall. If you look at the scenario, what was 1 decade down and now, I was just going through some survey just a couple of days back, and it was so encouraging to see that globally, there is 30% increase in women going to the higher ranks. That is something very encouraging. However, when you get in the Fortune 500 companies, you don't see major changes over there where you talk about women being in the board or being CEOs of the company. And especially if they are a leadership, they're majorly into HR or some of the functions, which really doesn't really get in the businesses. So I think there are a lot of limitations still, and some are built up and some are really genuine. However, I still believe that if somebody has to change it, it has to be the woman. Trust me, I'm of that opinion that no matter how much help you want to offer me, unless and until I'm willing to take that help, or I'm willing to put my extra efforts and think about it, the self-belief somewhere in the woman is a little bit of shaky. And for me, the personal experience has been not that great. I see a lot of women drop out at some point of time in their career. And for me personally, there are so many times I keep on calling them, hey, what is happening? There is so much of flexibility. I'll do X, Y, Z for you. Please come back. But it really, really surprises me when I see them not taking their career seriously. So I think first of all, and as women, if once we are determined to do something, we'll 100% do it. So I think the determination in women has to come up. And fortunately, the support system is in getting improved, whether it's from your family or it's from the organizations. A lot of things are changing, a lot of flexibilities are giving, but I still believe that woman has to really, really come up and ask for it. There is nobody who's, how it is, if at home I don't ask for food, I'm not served food, So we have to get up and we have to ask for things. We have to ask for the right positions, right culture, right compensation. I think we need to be more vocal for sure.
And also, do you think that when women rise in their career, they are given these opportunities, but they are the ones not willing to take it up because it requires a lot of travel, etc. And also, I'm making a very a statement which could go either ways. But do you think that women at home are the ones who are stopping other women to take on the charge of their professional life, saying that आपको ये करना चाहिए, आपको वो करना चाहिए? Do you think women are actually holding the other women back?
Definitely yes, but it has changed. See, I have a very positive outlook of everything I do in life, So I always try to look at the positive, because if you look at the negatives, it's definitely going to drain you down, There are compulsions, especially if we talk about India as a country, right? There are I still remember, even today, my mom will call me at 2 o'clock at night if I'm traveling. Hey, are you fine? Are you safe? I'm sure she won't call my brother or somebody else to check it, I think it's somewhere which I think is good as well as bad. Good in the sense that you have a family, you're emotionally connected. But on the other side, it sometimes puts you down, So I think it has to be balanced very well. You cannot put all the compulsion, all the pressure on women to do certain things and not to do certain things. But I still believe that it is two things will definitely change. One, woman herself, unless and until I make sure I have to do it, I should not sleep. Second, as a woman, I definitely need to help the other woman to come up. I think that's very, very critical, especially for people who are in leadership or who have the capacity or capability of pulling somebody up. I think it is a moral responsibility for us to do that. If we don't do it, it's a crime. And going back to home and expecting our mothers and grandmothers to change their thought process in a day, it's not going to happen, But with the new generation coming up and taking charge of things, I think, yes, it will shape up. Yeah.
You beautifully mentioned it's a moral responsibility, and I think this responsibility lies on every human being and not just a woman or a man. Chandra, my last question to you before I let you go is that you are at the helm of affairs at Trivitron. What are your plans for Trivitron in the coming years? Are there any announcements that we are looking forward to? Any expansion plans for Trivitron in the near future?
Yeah, there are a lot of announcements going to happen. It's a matter of time we'll announce that. But yes, for the company, for the organization, the expansion plan from going to routine to advanced to technologies is something in the pipeline. We have been doing it for the last couple of years. Like I told you, the advanced and high-tech technologies, or whether it's CT or it's a molecular diagnostic, or we are talking about next gens, you can see now, it's all in the pipeline. Certain things we'll be announcing next couple of months, and some things by the end of year. So, see, if you don't move up the ladder, if you don't expand, whether it's the product expansion, it's the region expansion. We have been globally present in most of the places. However, having a better space for us in each of the locations, whether we are talking of US, the biggest market you're talking, or the Europe. So a lot of JVs are happening, a lot of greenfield initiatives are happening. So the expansion plan is quite big for us, because, like I told you, if we can't do it now, when Indian medical device is supposed to be the sunrise industry, if we can't do it now, I think we'll never do it. So yes, a lot of new things are happening, and we will be announcing a lot of good news for everybody very, very soon.
Chandra, thank you so much for speaking to us. It has been such a pleasure listening to your vision about the industry, about Trivitron, the approach of collaboration that you spoke of, the importance of people skills that you emphasize on. And also, we're excited and waiting to hear more about what Trivitron is going to be announcing. I know you spoke about CT equipment, etc. I wish you and Trivitron the best and look forward to be in touch with you. Best wishes to you.
Thank you so much, Harbinder, and it was really nice talking to you.